I'd like to advise people is please um, be careful of your sources of information, because there is a lot of myths going on about the disease. There's a lot of fake news. There's a lot of um, marketing propagandas going on so that people can sell specific type of drugs, especially from some pharmaceuticals. So please be very vigilant of where you get your sources of information.
The uncertain times we're living today began when WHO declared COVID-19 as a global health pandemic.
That COVID-19 can be characterized as a pandemic,
forcing countries to go into lockdown.
The government is suspending travel for all persons coming into Kenya.
As panic rose across the world, most of us got quarantined. Claims were made all over the internet that COVID-19 wasn't real. Fast forward to 2021, COVID-19 vaccines were rolled out. Many countries, including Kenya, welcomed the vaccine with open arms. To some, this was the light at the end of the tunnel. In light of all this uncertainty, it is important to know that C.S. Lewis in his book, Learning in Wartime, said, "I think it is important to try to see the present calamity in a true perspective. The war, in this case COVID-19, remember there is not a new thing under the sun. Thus, this too we shall overcome." Join us, the Jesus Breakthrough Assembly Church, as Bishop Dr. Luke Mwangi, together with a panel of experts and professionals, discuss all matters: the third wave of COVID-19, 5G internet, as well as the vaccine. The church, in this time of confusion, ought to be a beacon, a light on the hill, an entity that believes in truth.
Shalom, my name is Bishop Dr. Luke Mwangi, the pastor of JBA Church, Jesus Breakthrough Assembly Church. We are located opposite Meteorological Department here in the Dagoretti corner. And many times I have come to the body of Christ with a message of intercession, like when you are dedicating Kenya. That is one of the areas I'm identified with. We also identified a lot through the God Bless Kenya prayer movement and Kenya Festival, when we did a lot of training and the mobilization of prayer in the nation. And today we have come here with a different mission, which I have never been able to actually mobilize before. But I thought in my apostolic and prophetic calling, it is good to also enlighten the body of Christ and get the message of this season to be more clarified medically and even spiritually, especially this season of COVID-19, which has brought standstill nations, churches, countries that were never moved before by any practical thing, have been brought to a very, very tough moment economically and medically in the whole world. Something of very importance came to me, that though we have been responding to the COVID situation through prayer, but then the Bible says my people are destroyed because of lack of knowledge. Now when this came to me, I noted that it is important for us at this point to become out relevant to the season, both with the spiritual responsibilities that people are supposed to do in this season, but also medical responsibilities. By last year, I had not gone to any hospital on a chronic matter for almost 28 years. For over 28 years. But last year, I had an experience with this virus, COVID-19 virus. And now when I went quiet on it and I was treated, and I'm going to share with you more. The doctor who attended me is here in this panel. Then I decided I cannot even keep quiet when I see my fellow bishops are dying. By last week, prominent bishops in this country, 29 have slept. 29. Now these are prominent bishops and apostles, not now pastors. If you go to level of pastors and believers, this thing is something that needs attention. We are going to use this experience to be able to at least save a life or two, because there has been a lot of ignorance There has been a lot of ignorance in this disease. Even sometimes people think it does not exist. I would like to introduce to you this forum. It is going to be very informative forum, both spiritually and also medically. We shall also see how to react towards tests, vaccines. There's been a lot of debate about vaccines. There's been a lot of debate about the tests, and very many issues have also come up, emanated from the issues of the disease itself, the treatment, the vaccination. Very mysterious indeed. It has come out that even maybe it looks like an antichrist system. But as I stand today here as an advocate of theology, I am very versed with the end time teaching. Most of you who know me, I've written a book on the second coming of Jesus. And I know about the Antichrist, I know about the mark of the beast. This season has brought a lot of confusion. And so, this wonderful panel here, and the questions that we are going to be dealing with, will help you to be very informed. Now, God allows certain situations to come to us so that we can help others. When Jesus healed people in the Bible, he told them, go testifying to other people that you have been healed. And nobody was able to keep silent. When the snakes were biting people in the wilderness, Moses was told to raise a serpent. And everybody would look at that serpent, would be healed. God has always had a remedy, spiritual remedy, practical remedy. As a church now, how do we respond with information to such a season? So it is a reality, and it is happening globally. I've seen that in America. They are sending photos all over in circulation. And so, welcome to this forum. And with me in this panel, we have Christian medical practitioners. We have 3 Christian medical practitioners and 1 engineer. They'll be able to introduce themselves, their credentials in medical field and where they work. And you shall permit us at least to be able to talk to you face to face. And we have observed social distancing and all the other protocols. So they'll be able to talk to you and also introduce themselves. Beginning on my right, we shall have the introduction.
My name is Dr. Maureen Shabuya. I'm currently working in Machakos Level 5 Hospital. I'm a medical doctor by profession, but I specialize in ophthalmology, that is the health of the eye. Thank you.
Thank you very much for having me. My name is Dr. Ian Kithinji. I'm a medical officer by profession. I currently work at Avenue Hospital, which is a tertiary facility in Nairobi. I currently work in critical care in ICU, and I've been working in this, dealing with this pandemic since it began. I've been working in the COVID ICU and COVID isolation units.
Thank you, Dr. Luke. My name is Japheth Kilonzo. Trained and also with the technical orientation in both construction and the telecommunication industry. I've worked in the telecommunication industry for the last 11 years, majorly on Safaricom, Airtel Telecom, and formerly the ESA Telecom Kenya. Thank you.
Thank you.
My name is Geraldine Juba, a medical laboratory officer, currently working at Nairobi Women's Hospital at Hurlingham branch. Currently, I'm involved in the COVID testing, that is in the molecular laboratory, whereby we're doing all the molecular tests, and our main lab, which is Hurlingham, is the one that is involved in most of the COVID testing. And currently, as we talk right now, we have had several cases across all our branches, Hurlingham being the one handling the most cases. For now, we encourage testing.
So, To begin, we would like to understand what is this COVID-19 virus and what is the source. We want to know from this technical panel, especially we begin with Dr. Ian, who is dealing directly with this emergency response to COVID in Avenue Hospital. And I owe him a lot of gratitude for that kind of response. So Dr. Ian, what is this COVID virus? And what are the people talking about as the source? And what has been your experience about it? Is it a technical thing? Is it a medical condition? What is it, according to your information?
Thank you very much, Dr. Luke. Maybe I just do a background about what infectious agents are. So there are 4 major types of infectious agents, and what an infectious agent is an agent that is able to cause disease. So the major ones include viruses, bacteria, fungi, and there's a small subgroup called prions. And these are agents that are able to cause disease. So coronavirus is in the class of viruses. It's a virus. And it's in the family of viruses called coronaviruses. So it's a subtype under that family. So there are many families of viruses, and one of the families is coronaviruses. And coronaviruses have been with us for many years, for more than 30 years. But usually for human beings, they've been known to cause mild disease. Actually, a lot of the common colds people get, some of it is attributed to the family of coronaviruses. But then now we had this new strain, or this special type of virus under the coronaviruses, which was now causing a bit of more severe respiratory disease. And this was named, actually it was named as SARS-CoV-2. Initially there was a SARS-CoV-1, which caused a pandemic around 15 years ago, which started again off in China. So this caused the SARS pandemic, if you can remember about the SARS pandemic. Then after the SARS pandemic came the MERS pandemic, which is the Middle East type strain of the coronavirus. So it was initially the SARS pandemic, then we had the MERS pandemic, and then now we have this coronavirus pandemic. The classifications are usually given due to the genetic makeup of the virus. And this genetic makeup of this current virus that we're having was very similar to the SARS virus that happened 15 years ago. And so that is why it was named as SARS-CoV-2. So the virus itself is called SARS-CoV-2. COVID is the name of the disease it causes. So COVID actually is a mnemonic standing for coronavirus disease. And since this disease first came out in 2019, so it's known as COVID-19, COVID virus disease 2019. And so that's just as a background. So the origin, as I said, coronaviruses have been with us for many years. And so these viruses initially were discovered in the bats. We call it a zoonotic disease. Zoonotic means it affects animals. It's like the disease that can affect a cat or a dog. So this disease initially was affecting bats. The coronaviruses were initially found in bats. It was a virus causing disease in bats. However, people in the Asian countries tend to have a lot of interactions with these animals. They eat bats. They eat other different types of animals. And so this disease then was transferred from the bat to the human being as part of a cross-infection between species. So they think the origin of this coronavirus 2019 is the bat. But then since the interaction between the human and the bat, even in those countries, is not too much, they think there's another intermediary animal that is involved in this transmission. And that they think is an animal called the pangolin. So the pangolin is an animal found in China, and it's a delicacy there. So where this disease originated from, which is Wuhan, China, they have a market where they sell all these wild animals, game meat, basically. And so they have a lot of pangolins there, and they think that the disease maybe came from the bat through the pangolin now to the human. And so that is where it is believed that the source of coronavirus is.
Wow, what great information. I was watching a documentary on BBC and CNN. They are doing investigations about the bat, and they are saying it carries over 1,000 viruses in itself and many others. as Dr. Ian has clarified, that the source, the conspiracy that was there before is not what people think today. So in the same issue of the source of the virus, one of the biggest conspiracies that was mentioned that time is that also this virus came as a 5G source. And it came from the 5G source. So I would like to turn this moment to engineer. This company has been contracted by the biggest technology firm, Huawei, to be able to connect their networks in this country. To tell us what is this 5G and has it anything to do with the COVID? And even if it is not COVID, does it cause radiation that would affect the country? Or when you are using your mobile? Because all these things came with the conspiracy of COVID last year.
Thank you, Bishop. Maybe I can give us some background information in terms of where we have come from, where we are, and where we are headed to in terms of the telecommunication technology. In the year 1790s, people used to communicate using signals and drums, more so in Africa, America, and Asia. Then in the year 1830, this technology about telecommunication was discovered. Coming forward, and because we are currently operating in Kenya, in the year 2000, the first rollout for mobile network was launched through Safaricom and Airtel. And in the mobile technology, or rather mobile network technology, we have several generations. We have generation 2, generation 3, generation 4, which we call 2G, 3G, and 4G. Currently, we are at the 5th generation, which we are calling 5G. Now, 5G operates as, the same way 4G operates. The only difference is that if you want to download maybe a movie or a video, it will take you very short time as compared to someone who is using 4G. Why? If you are downloading a video clip or a movie using 4G, it may take you 20 seconds, but someone using 5G, it will take you 20 milliseconds, but someone using 5G will only take 1 millisecond. Now, the target in terms of how big, the size of data we should download at a given point in time, the target in Kenya is around 1 gigahertz. But already what we have achieved is 400 Mbps. So 5G does not cause corona. Why? Because corona is a virus. The only thing 5G can cause is radiation. But because we operate within the law, even in other countries, we have regulatory bodies, also in Kenya, like we have Communications Authority, we have NEMA. Before you put up any new structure, you must get approval from these bodies. You go to the US, we have the Federal Communications Commission. Now, in terms of where 5G began, why is it that in Africa we are now talking about it? 5G was first rolled out in South Korea in the year 2019. In the US it is there, but in large scale rollout, it began in South Korea. In Africa, because Kenya is country number 2 in terms of IT compliance after South Africa, we find ourselves being second or rather next in line after South Africa. South Africa, it began last year. In Kenya, we have only done, I think, around 4 stations. And this is only in Nairobi. We don't have 5G in Mombasa. We don't have 5G in Nakuru. We don't have 5G in the Western region or in any other part of the country. Actually, if you go to the rural areas, a lot of people there, the most advanced ones are using 3G. 4G has not even penetrated into the rural areas of our country. Thank you.
Very important. And just before I come to issues of testing, I would like to make a disclaimer in this panel. We believe in medical. We believe in divine healing. Geraldine here works in the tests, medical tests at Nairobi Women Hospital, which is very well known. I would like her to tell us what is really going on about the tests. At what stage should somebody be recommended? Because one of my friends that I lost just the other day, in our platform, they were very sincere, and even in the day we were celebrating his life, they said that they did not know that he had been infected by COVID until the 9th day, when things were becoming worse, when they realized they have to look for a doctor at a place for medical attention. It was the 9th day. He was just dealing with it domestically. And I believe also that the quick response and advice I was given by Dr. Ian helped me to have, and of course, a great support I was given from home, encouraged by my wife and my son, who took me to the hospital very fast. I believe all those attributed towards my quick response for medication and attention during that time. And so what would you say about early tests? Because most of the people are falling victim because they don't want to respond to that tests.
Usually, laboratory medicine is the backbone of all medicine. So, most of the time, we tend to think that, as a layman, we may think laboratory testing is not very, very essential to us. But to me, I would say, in the first day, maybe when you have the signs, most of the people who haven't COVID, some have presented with various signs and symptoms, while others have no symptoms at all. Others will have just an headache, like in my case, I had just an headache, only to find out that at one point I had contracted COVID. So most of the time, people are expecting maybe to have that severe cough, running nose, shivering, headache, or joint pains. But at times, it may not be the same case. My immunity or my body may not present like the other person. So what I would advise or what we encourage, nowadays we don't wait until you present with various symptoms so that you can get tested. We encourage everyone to go for the testing, since we have various types of tests. We have 3 types of testing. We have the rapid testing, which is the antigen rapid testing. We have the PCR, and we still have the antibody testing. So the antigen testing is much cheaper than the other 2 testing types. So in all this testing, mostly the antigen testing, the rapid antigen testing, and the PCR, we will need a sample from you. That is a nasopharyngeal swab. You take a swab from your nostrils that will go up to your pharyngeal, of which it's not very comfortable, but most of the people will not agree. Most of them have not had a good experience with it. So, as much as it may not be comfortable, we still encourage to do that.
Yeah.
It takes less than a minute to take the sample, so you can bear with the situation in less than a minute, and the sample is taken. Once the sample is taken, the rapid test will be done, which takes within 15 to 30 minutes. The result will be out, and after the result, whatever the result, we always encourage to see the doctor for further advice. Some facilities will test at 3,000, at least 2,500 to around 5,000, which is affordable to most of the people. Then we have the gold standard, that is the PCR, detects the presence of the amplification of the DNA. The previous one, that the antigen will just detect the presence of the virus. But now in the PCR testing, this one will amplify the viruses, the DNA viruses, the DNA of the virus. Mm-hmm. So if it is in the body, it will give out the copies. Amplification, that is like it's multiplying. So it will give you the exact number of viruses you have. But in the antigen testing, it will just tell you it is either positive or negative. It won't give you the quantity. Then we have the testing method, which is the antibody testing. This will test to show if you had a previous infection or the contact with the virus. And this mostly is done to monitor, maybe after your treatment, if the virus has cleared from the body, from the system, and how well are you responding? How well is your immune system responding? We encourage you first do the antigen testing, which is more cheaper. And this, since it's about 95% accurate, you don't have to worry. You don't have to say that how accurate or how whether it will be accurate enough for you to get treatment. It is accurate. I would say even the PCR is still there. But for those who may be having the financial challenges, you can try and have the antigen test. So what I encourage, let everyone be tested and let's adhere to the MOH guidelines.
Amen. Very important. Now we have a Dr. Maureen who works in a level 5 hospital, and many people are just saying, maybe they are just saying that COVID is just in the city, Nairobi. And maybe somebody will be listening to this video because I have networks of pastors who have been attending our meetings even in the village. Somebody will be saying, hiyo ni mambo ya Nairobi or the county tano. I don't know what has been your experience because you are in Machakos and having also worked again in Kenyatta. What has been the experiences of people who have been coming for COVID treatment, and what would you recommend, especially when people coming from the village, because when you're in Machakos again you get people from the interior. Would we say that this disease has gone to the interior and that somebody from the interior needs to be careful the same way somebody in the city should be?
As Dr. has alluded, I work in Machakos Hospital, and once a doctor, always a doctor. Yes, I've specialized in the eye, but I've had to interact with the doctors working in the COVID ward, because as a specialist, you must give guidance to your juniors, to your fellow colleagues who are in the COVID ward. And I will tell you for sure, Machakos is one of the best hospitals in the Nairobi metropolitan. Actually, in the place where I work, you would realize that we cover patients from Machakos itself, from Kajiado, from Makueni. Makueni goes all the way to almost the coast region, and we also cover patients from Nairobi. So you can imagine when we are telling you that COVID is real, and somebody from Nairobi tells you, no, this is just a propaganda, that is a fallacy. It is not true. Because in Machakos we have an ICU ward, around 10 bed capacity. We have an isolation ward, and those facilities I'm talking about, those ward areas are actually, the isolation ward is around how many beds? I think the last I checked was around 15 beds there, and they were all full. And to add on that, we also started like a center for COVID in the Machakos study, which had around 200 bed capacity. And we also deployed doctors to those areas. So actually COVID is very real. It's not only in the towns. We get people from the interior of Machakos, like any other town. There are those interior places, they have their different names. And they come when they are actually sick. Like in the eye department, somebody comes and tells you, Daktari, hii macho inanisumbua. And you check and you check and you check this one. But the eyes are basically red. We are having the person is staring, cannot even look at the light, you do everything, and basically there's nothing. Then you tell the patient, you sit down, because part of doctor's work is to take history from the patient. And you sit down the patient and you ask the patient, have you had any cold in the recent past? Anakwambia daktari, I had it ni kitambo, imekaa siku 5 inaenda ikiisha. Unamwambia okay, ulikuwa unakohoa? Nakwambia ndio. Unamuuliza, have you come into contact with somebody with similar situations? Anasema daktari, kitu iko tu huko kwa kijiji. You see, such are the comments people make. And you tell the patient, this I would ask you to go and have a COVID test done. And of course, you do your symptomatic treatment. That is, you look at the eyes, they are red, they are swollen, a bit of allergy here and there. So you give the symptomatic treatment. And you tell the patient, go and do this test and bring the results. And lo and behold, the positive results come back. So, you know, the symptoms vary for this disease. You would think it's just a running nose and a cough that clears, okay, and maybe a bit of a cold. They would say the weather is changing. And the first place you learn is the eye clinic. And I do everything to my capacity, and I tell you, according to what I think you should do, go and have this test done, and you come back here positive. So you see, you don't have to land in a physician's hands like Dr. Ian. Dr. was lucky he landed in Dr. Ian's hands. What if you land in the village where there is no physician?
Yeah, that's true. Yeah, that's true.
So this thing, there's a lot of knowledge that's still going on. There's a lot of research that is still going on.
Yeah.
Many of these things are non-specific. I can't tell you that if you come with red eyes, it's COVID. No, I can't tell you that. But for sure, COVID is there. So as a practitioner in Machakos, I will tell you, COVID is there. It's prevalent in the community as it is. And there are also very high incidences, like you see with the third wave that we currently have.
Yeah. The information from this panel is reaching to even my fellow bishops and pastors in the village. I would like to say this. Can we save a bishop or a pastor or a believer or a relative by telling them to be checked and to go through these checks? If you look at vaccination, it has a history of preserving lives. Let's be real. I would like Dr. Ian to tell us more about vaccines, what they do to the body. And this one of COVID, because again I was privileged through his contact to be vaccinated. I have already taken a vaccine, I'm not going to lie. What is this vaccine and what is it supposed to help us in the future, and how seriously should people take it?
Maybe we can start off by the history of vaccines. Vaccines have been with us now for maybe 100 years or more, and they have been very effective in terms of controlling and even eradicating some diseases. There's some diseases that most of us, maybe Generation Y, Z, haven't encountered. Something like smallpox. And smallpox was a killer. It was a huge killer. And it almost killed almost a quarter of the world's population at that time. And with the development of the vaccine, no one has had smallpox over the last several years. Polio is also another disease that is almost being completely eradicated through vaccination. And Kenya, I think, got its certificate of 0 polio cases recently. So many diseases have, the vaccines have come in as an important regimen in terms of winning battles against diseases. And personally, in my personal and professional opinion, I think the key to winning this war against COVID is purely through vaccination. That is the key that is going to win us this battle for COVID-19. Initially, people were talking about something we call herd immunity. Herd immunity is a concept where the spread of a disease is stopped once more than 80% of the population has attained immunity against that disease. Okay? And so there were two ways of getting to herd immunity. One way was to let the disease run rampant. You let it run, everyone gets it, and when everyone gets it, people have developed immunity against it. If I get it and you have immunity, you have immunity, you have immunity, I can't spread it. So the disease ends with me. But then the price of herd immunity through spreading an infection it's a price that we cannot afford to pay. Because COVID now has a mortality. Mortality means the people who die from the disease ranges from 2 to 5%. Kenya, we have a population of 50 million? If we say 5% of 50 million die, that's more than 2.5 million deaths. That's a price we cannot afford to for trying to achieve herd immunity. So through vaccination, we can achieve herd immunity without loss of lives.
Wow, that's great.
So through vaccination, people are able to develop immunity. And if the country and the president are able to garner enough vaccinations for the population, then that is the key to winning the battle for COVID. That is the key to winning the battle. So the vaccine. So I personally would encourage anyone. Currently, the government guidelines are that anyone above 58 gets the vaccine. If you're above that age and you're able to access the vaccine, then I would highly encourage you to access it. Over time, because the government is rolling out the vaccine in phases.
Yeah.
I mean, the next phase probably will be people who are at high risk, people with other comorbid conditions. And then as it's being rolled out in phases, when your time comes, so go and embrace the vaccine.
Yeah.
People should not fight this vaccine because one, practically all of us have been vaccinated for something.
Exactly. That is what I was telling you.
So everyone has been, from birth, the amount of vaccines children take are quite many.
Yes.
Maybe against 7-10 diseases.
Yeah.
That is from birth till when a child is around 3 months.
Yeah.
So you cannot reject this vaccine now, and your parents gave you the benefit of vaccines from the past. So actually, for me, refusing a vaccination is being irresponsible to your neighbor. Because you will get the disease and you will infect someone else.
Yeah.
That will be irresponsibility in someone's own innate nature to reject or refuse a vaccine that has been proven to work. Yeah. So the vaccine that we have currently in Kenya is the AstraZeneca vaccine, developed by Oxford. And the good thing about this vaccine, there are many ways that vaccines are prepared. And how this vaccine is prepared, it's called a vector vaccine. And what a vector vaccine means is that they take the RNA. This virus is not a DNA virus. An RNA means it's a single strand of information. DNA means 2 strands. So the virus is a single strand virus in terms of the genetic makeup. So they take that RNA of that virus and they put it inside another a carrier, another disease pathogen, which usually is inactivated and does not cause disease. So some have used another virus called adenovirus.
Yeah.
So they take the genetic makeup of COVID-19, put it in that virus, and then that is what is injected into people. Okay. So that is what we call a vector vaccine. And the good thing about what we have the AstraZeneca, some of the important features it has is its storage. It's stored in temperatures between 2 to 8 degrees, and in that temperature it can survive. The virus is active can be used for up to 6 months. So that is good because for a country like us, some other countries are getting other different types of vaccines. Maybe let me just mention most of them. We have the Pfizer, which is from the US. We have another one called Moderna. We have the Russian one called Sputnik 5. We have and we have AstraZeneca. But there are others which are still in the pipeline, undergoing research. Yeah. So this vaccine, the problem like with Pfizer, the storage conditions are very difficult. It needs to be stored between -60 to -80 degrees Celsius. In a country like ours where we don't have such facilities distributed everywhere, then it's difficult to really have that vaccine. So this vaccine is good because one, it's easy to store. And since it's easy to store, then many people can get it and it can be easily accessible. So the thing about it is many people are concerned also about maybe
the side effects.
And the things that they've heard on media about the different challenges that it's having. As there's usually an adage that goes, you can't get the rose without the thorns. there's no way you can get anything with 0%
effects.
Without any negative effects. But the thing is that most of these effects are mild.
They are mild
for most people. So, and usually these mild effects tend to be headaches, maybe a slight fever. Even children get them. Even when children are vaccinated, mothers are usually told to have paracetamol on the side. Children can get some of those effects. So so the vaccine tends to maybe a headache, some joint aches, some fevers, some generalized weakness, but these ones are short and take a short time. But in summary, I'd just like to say, I'd encourage everyone to get the vaccine. The vaccine is currently, the studies have been done from people above 18 years old. So if you're above 18, and once that time comes, because the government is rolling it out in phases,
yes.
Once your time comes, then do not reject the vaccine.
Wow. What a great advice. Almost half of the country is connected to somebody who has either died or who has been healed or who was in a hospital. So I would like to say, in this panel, we are bringing information to save lives. You have been a lot in the testing part, and you have also been following about the vaccine and the response. Just like we have said in tests, would you think that they will reach a level where vaccines will be mandatory? And was it targeted that way before? Because people say that it was a long-term plan. What is your take on this? Because you are in the testing ground and the platform. And what are the medics saying on this platform? So that we can prepare people also for this.
First of all, to let everyone know that before the vaccine was brought to people, it had to be tested and tried. So it's not that right now it's like they are being used as guinea pigs to test the efficacy of the drug. So they should not worry much about being the guinea pigs. We are not the guinea pigs. Before it was introduced to us, the vaccine was already tested and it was found that it would work against this virus to at least 90%. So my take would be, let everyone be vaccinated. They should not get so much worried that this vaccine was brought to maim the Africans. I've seen many say that this thing has been brought to us. Initially, they were saying the virus was brought to clear Africans. The second time now when the vaccine came in, people still came in and said now they have brought, since they were unable to eliminate us through the virus, they now brought in the vaccine to eliminate us, to reduce the population, which is not true. To me, it's not true. So they should not be worried. I would encourage everyone to get vaccinated. When your time comes, as Bishop says, let's go ahead and get vaccinated. I myself am already vaccinated. According to me, as cases come in, I can see it will come to a time if the virus is still with us and we don't know how long it will take to clear. So it might come a time when we'll be told it will be like a mandatory thing to do. Like we have measles now, children, maybe a time will come when the children to be incorporated in the regime for the newborns to be vaccinated on the same. Or like we have the yellow fever vaccine, whereby it will be a requirement. Maybe we want to travel or we want maybe to assess something, some things you have to have the vaccine. So to me, I don't see any worry or have fear that the vaccine is here with us. Let it be a personal decision, because it may come a time that maybe you push someone to do it, then by bad luck something happens, medical problem comes in, they might come back to blame you, saying that to force them to do the vaccine. Let everyone make a personal, informed choice and a personal decision to take the vaccine. It's not that painful, as doctor has said. The symptoms will just last for a day or two. As the extreme, I have not heard of somebody who has gone down for 3 days because of the vaccine, and they're not that severe. It's just maybe a few aches here and there or a fever and it's gone. So it's not something that will maim you down or bring you down. Just do the vaccine and we will be good to go.
Yes. And as we close in on this matter, I would like also to emphasize something about prophetic timing. Anybody who has ever said that there's going to be a secret pin to be put in the people's bodies as a sign of 666, I would refer you back to my teaching on end time. I did 22 lessons on my book on end time. We have proofs that the number of the Antichrist cannot come before the church is raptured. I don't want to address it now, but I gave 7 reasons why I believe that the Antichrist system will come after the rapture. There are 7 reasons. Check my page. You will see that. Just a few last questions about the vaccine. Maybe what have you heard, or what is take about the people who should take and those who should not take? Like there's some people are talking about age, pregnant, the pregnant women should not take. What is your take on that? Have you heard about that, and probably has it reached a level where a decision has been made about that?
The WHO basically is usually a standard. When you want to get legit information,
yes,
organizations will actually go, because they go through research, they go through very rigorous activities before that.
Yeah.
So the vaccine, as Dr. Ian alluded, most of these have been tested on 18 and over. So it's just that they are still rolling out in phases, as they've said.
Yeah.
So once you are 18 years and over in the time comes, you are actually eligible to take the vaccine. As he also alluded, the side effects are very minimal. You'd rather suffer the minimal effects of fever, fatigue, and lethargy for just 1 or 2 days than suffer the whole financial cost and the whole pain of going and being in an ICU. You also cause so much trauma to your family. You'd rather take the vaccine and have a few side effects than get the COVID-19.
Yeah.
Now for pregnant mothers, the same thing also.
Yeah.
I usually look at studies. There's a study that was published in the British Medical Journal at the beginning of February by some doctors. And they say that people who are in the fertility age, that is the reproductive age, are not barred from getting the vaccine. Why? Because there is so much going on about vaccine and reducing fertility. There is no evidence to show that the vaccine reduces fertility. Some studies have shown that because of depending on the immunity of the person, you can have very high fevers. What it has actually shown is that with the high fevers, you can only have temporary reduction, especially for men, in the sperm production. But that does not give you a permanent sterility.
Yeah.
It does not give you that.
Okay.
So those are findings that have been shown.
Yeah.
For the pregnant women, they also say it is not a contraindication per se. Studies are being done, but the statement that was given is that it's not a contraindication per se for the pregnant people to get, even though studies are still ongoing. But they say if you are a pregnant mother and you get COVID-19, you're already immunocompromised. Naturally, when you're pregnant, your immunity is not like any other person. So if you get the COVID-19 disease, it might have a more fatal effect the pregnant woman than if she actually got the vaccine. So the recommendation is that if it's a pregnant woman who really wants to get the vaccine, that should not be a hindrance for the person to get the vaccine.
There is an issue of how long does it take after you are vaccinated? Will it take like 1 year or 2 years? Do you think like after 3 years again people will need to be vaccinated again?
To answer the first question of how long we expect for us to have the immunity once we get the vaccine, maybe I'll just go back to how vaccines work. So how a vaccine works is that we introduce a protein that mimics the disease but cannot really cause the disease for you to elicit an immune response. So when you elicit an immune response, you develop some of the cells which are called memory cells, memory immune cells, and these cells remain in your body. And so that next time, you develop memory cells and you also develop antibodies.
Yes.
So the antibodies stay for some time and they remain in your circulation for some time. And so when you get a new infection during that period that you have the active antibodies, then the antibodies are able to kill the infection very fast before it can cause disease. Yeah?
Yeah.
But then you also develop things called memory cells. And these memory cells are cells that remember.
Okay.
And that's why they're called memory cells. They remember that previous infection that was there.
Okay.
And those help you to mount a faster immune response.
Okay.
So these memory cells are able to divide very fast so that they create an immunity against the virus. So currently the vaccine has only been given for a short period of time. So studies have not yet confirmed to how long the immunity is going to be against the virus. So this is still ongoing.
Okay.
The study of this is still ongoing.
Yeah.
But we know at least in the short term that it's going to provide immunity for the people, and hopefully it's going to develop memory cells that can even protect you in the long term. So that study is still ongoing. In terms of how long do you expect to have this immunity for?
Yeah.
So the second question that I was asking, we have been having other infectious diseases in Africa: malaria, cholera, HIV, and now even some other non-infectious diseases like cancer, which are now of public health concern. And why is it that COVID now has really overtaken them all? And the reason why is because of the potential in terms of how devastating COVID-19 can be to a population. The potential of what COVID-19 can do to a population.
Thank you very much for joining me today. We're going to be discussing a few issues on the COVID-19 disease, maybe as a continuation of the previous clip that we had recorded before. So we're going to talk about three major issues. One is the mode of transmission for COVID-19 disease, and two would be the ways that you can prevent yourselves from getting the COVID-19 infection, and three, what are the home remedies that people can use at home for the management of mild COVID-19 disease. And maybe fourth and final would be what are the credible sources of information that you can use to get your information on COVID-19 disease. So maybe first we'll start with the modes of transmission. So how is COVID-19 spread? So COVID-19 is spread through three major modes of transmission. The main one, which you're going to really focus on, is a droplet mode of transmission. And what do droplets mean? So the droplets mode of transmission is whenever a person is talking, coughing, or sneezing, then they do release small droplets. Normally will be in the form of saliva or mucus, and these droplets can land anywhere from surfaces to another person's face. And when these droplets are transferred from either this surface or directly onto someone's face, especially what we call the mucous membranes, this include the mouth, the nose, and the eyes, then that spread will result in a COVID-19 infection. And so droplets are the main mode of spread of COVID-19 infection. Secondly, we have what we call the airborne spread. This initially was thought to be might have been significant in terms of the spread of the COVID-19 disease, but from research it is seen that it's not a major mode of spread. But this mode of spread is particularly important for healthcare providers, people who are working very closely with patients suffering from COVID-19 disease, and those patients are on what we call aerosolizing procedures. These are basically things that cause the airborne spread of COVID-19 infection. And these procedures include oxygen supplementation, things like nebulizations, what we call invasive procedures where they have really to go in through your mouth, maybe something like intubation where they insert a tube down your throat, maybe to help improve the function of the lungs through what we call ventilation, that is for ICU cases, or other invasive procedures which might lead to aerosolization. So majorly the airborne mode of transmission is particularly important for healthcare providers. Third mode of transmission, which its significance has not really been explored, or we've not had enough evidence to establish whether this mode of transmission is significant, is what we call the fecal-oral route. What has been seen is that the COVID-19 virus is shed through the stool, which is basically through feces. And so if someone comes into contact with this contaminated stool, that is either through contaminated water or contaminated fruits and vegetables, as some of us may know, some of this, with sewerage systems that are not ideal, then there's a risk that this might be a way of transmission for COVID-19 pneumonia. However, its significance has not really been proven. So what we shall really focus on is the droplets spread of COVID-19 disease, which is the main mode of transmission. And this is where comes in our prevention modalities, because we say this is the main form of transmission, then how can we prevent that? So then we come into our second question, is how can you prevent yourself from getting or developing COVID-19, getting a COVID-19 infection? And so, most of the modalities are targeted towards the droplet spread of COVID-19. And one is wearing masks. So for wearing masks to be effective, then the person, the spreader and the preventer both have to wear masks. Because when you wear a mask, then if you have COVID-19 disease or the COVID-19 infection, then when you cough or talk or sneeze, then those droplets do not spread to the outside environment. And if you are COVID-19 negative, then if you wear a mask, then if someone without a mask or with a mask is in very close proximity, then the droplets then will not spread onto you. So then for us to have this measure being particularly effective, then both partners, both people then have to be wearing masks, which basically means collectively as a group or as a nation, then we all have to be wearing a mask at all times, or whenever we're interacting with other people. Then two, these droplets then, as we say, if someone is talking, then these droplets can always fall onto surfaces, so onto desks, onto whatever, even onto people's hands. And so washing hands regularly, and also non-contact modes of greetings are also very important in terms of preventing spread of this infection. So washing your hands regularly, because then if you touch any surface or you come into contact with these droplets, then by washing hands, then you effectively kill the virus. And three, then cleaning our surfaces regularly, especially if you're in an indoors area, then cleaning your surfaces regularly then prevents that spread from the prevents a person from getting into contact with these droplets, which are on the surfaces, and then transferring them to the mucous membranes. So then cleaning surfaces regularly then is also important. Then the fourth aspect, another aspect of prevention, then is social distancing. That we say these things are spread through droplets. So the farther you are, then the drop makes it very difficult for the droplets to get to you. So the WHO advocates for a distance of at least 1.5 meters between individuals. And I think with all these prevention measures, if we take, then we can prevent the spread of COVID-19 disease significantly. So we come, then maybe what I'd also like to discuss is in terms of masks, what kind of masks then would be effective in terms of prevention of COVID-19 disease. And my answer to this would be any form of masks. That is the range from cotton masks to surgical masks to the N95 masks. And this is because all these three types of masks are effective in terms of prevention of droplet spread, which I said is the most important form of a spread for COVID-19 disease. But the trick towards this mask is that everyone has to be wearing it. For this mode of prevention to be effective, then everyone is a collective responsibility for all of us to always have our masks on. Good. So next, what we discuss is the home remedies for management of COVID-19 disease. First, as a precaution or as a caveat, I'd like to say that any patient who is diagnosed with COVID-19 disease has to have a health practitioner on board in terms of their follow-up and their care, and that you should not do it on your own. Um, uh, you should always have a health practitioner on board, and that home-based management then can be converted to inpatient management at any time with this follow-up, depending on the doctor's advice. So we shall discuss a few things. So one, COVID-19 disease, then COVID-19 virus then causes what we call COVID-19 disease, and COVID-19 disease is then classified to either mild, moderate, or severe disease. And mild disease is ideally what WHO advocates for home-based care. We remember initially when this outbreak began, then everyone was being managed in a healthcare facility, but then the numbers shot up significantly, and it was unsustainable for stable patients to be managed in healthcare facilities. So the healthcare facilities uh, are now saved for patients with moderate, severe, and critical illness. So for mild disease, what the WHO now is advocating for uh, people with mild disease. And who are people with mild disease? People with mild disease are the people who have what COVID-19 symptoms, which are generally upper respiratory tract symptoms. And what do these symptoms include? This includes a headache. You can have a sore throat. You can have a running or a blocked nose. You can have fevers. You can have joint pains. You can have a mild cough. And this generally is what will constitute mild disease. And for these patients, then the disease has not really gotten to the chest. These patients do not have a pneumonia. That is either on clinical examination or on imaging. So these are patients who will be classified as mild disease. So what regimens are then advocated for by the WHO and the Ministry of Health for the management of mild disease? So one, we advise for majorly management of symptoms. And these symptoms, I said, majorly will be headaches, fevers, joint pains, running nose, and a slight cough. These are the most common symptoms that have been reported. So for these patients, we advise to have painkillers, your regular painkillers, starting from Panadol to what you call non-steroidal anti-inflammatory drugs. These include Brufen, diclofenac, in those likes. So this is actually might be the mainstay of mild COVID-19 disease, basically what we call symptomatic management. Other things that the WHO is advocating for is good nutrition. So always have a balanced diet, a diet that is very rich in vegetables and fruits, and also adequate hydration of the patients, and also regular exercising. This is what the WHO advocates. Initially, many drugs had been purported to be very effective in managing or preventing the development of severe disease in these patients, and most of them now are discouraged by the WHO because they have been shown based on research that they do not have they're not effective for management of COVID-19 disease, and this includes antibiotics. I know many people used to take a lot of azithromycin when diagnosed with COVID-19 disease, but then this has now, based on evidence, that it's not effective in terms of either preventing severe disease or management of mild COVID-19 disease. So we do not advise for the use of azithromycin for patients with mild COVID-19 disease too. It's a drug that has also been really becoming very popular and it's really trending a lot. Ivamectin, and this is a drug that is used for the management of parasites in the tummy, basically worms, some special types of worms, and it's actually a very common drug because it's been classified in the WHO what you call essential drugs list, and this drug list means that this drug should be available in all health facilities. That means this drug is readily available, and people thought that this drug then would be the secret to managing or preventing severe COVID-19 disease. However, based on research, it has also not been shown to be very effective. It had a lot of promise initially because then in the lab that this drug was seen to prevent replication or division of this virus, but then the doses at which it is required to do this disease prevention then is very high, and this cannot be given to a human being. So that's why this drug, based on the current research, has been shown it's not effective in terms of preventing severe disease. So we also have the cocktail of vitamins that people usually get: vitamin C, zinc, and vitamin D. Then WHO has no evidence for or against the use of them, but personally, I think they can be used because then these medications tend to have an impact in terms of helping the immune response. So then you can use this drug, vitamin C, zinc, and vitamin D. However, the other drugs that I mentioned are not really applicable. That's ivermectin and antibiotics. Use of blood thinners is also not advocated for home-based care, especially for patients with mild disease, because then this um, blood thinners and steroids are not advocated for patients with mild disease, but these ones are used for patients with moderate and severe disease in the hospital setting. And these two drugs have been shown to have an effect for patients in the inpatient setting for severe and critical disease. So the setting for the blood thinners and the steroids is only in the setting of inpatient. That is when we do advocate as a maybe as a let me write down. Okay, maybe as a point to just mention, dexamethasone might actually, as a steroid, the steroids that people are being advocated for might actually put people at a risk of developing severe disease when it is used for mild cases. So that's why I'm saying it's very important before you start or initiate any form of treatment, please just discuss with your healthcare provider. Steroids have also been shown to increase the period of shedding of the virus. So you may continue to have a positive test for a very long time because you have been using steroids. So those are some of the challenges, and that's why for mild disease, what is purely advocated for is symptomatic management, good nutrition, hydration, exercise, and maybe the vitamin and mineral supplementation. Those are the remedies that we can use at home. I've seen people doing a lot of steaming. I think this also helps because it also helps with the symptomatic management. So that you can also continue and you can also do. The others for moderate, severe, and critical disease, these ones, I will leave them at the discretion of your healthcare provider, and that anyone with mild disease or anyone on home-based isolation, home-based quarantine, then should always be in continuous communication with their healthcare provider and continuous monitoring, so that in case anything changes, then they can always be converted to an inpatient setting. So early recognition of deterioration of the disease is also very important. Another thing that the WHO is also advocating for inpatient care, for outpatient care, for home-based care, is the use of the pulse oximeter. So the pulse oximeter is a gadget that is used, which you put on the finger, and that this gadget would estimate your oxygen concentrations in blood. And this is very important in terms of monitoring patients for home-based care, because anytime these oxygen concentrations go below 94%, then it will be important then to have a healthcare provider, a healthcare practitioner review. So always, any patient on home-based COVID-19 monitoring should be in continuous communication with their healthcare provider, either through calls, through telemedicine, or through home-based visits. Yeah. So the other thing we need to discuss is also For these patients who are on home-based care, we also sometimes tend to risk stratify them. So we consider patients for home-based care who are at high risk of progressing to severe disease. These are patients who are elderly, patients above 50 years old, and patients who have comorbidities. And what these comorbidities are, these are long-term diseases. So any patient who is on management for high blood pressure, diabetes, HIV and AIDS, cancer, obese patients, and even elderly males tend to be at a higher risk of developing severe disease. Pregnant women are also classified in this category. So if you're a high-risk patient, then home-based care for you would require very close monitoring by your healthcare provider. And in case you develop, you progress to moderate or severe disease, then a different set of action can be taken for you. So finally, last but not least, what I'd like to advise people is please be careful of your sources of information, because there is a lot of myths going on about the disease. There's a lot of fake news. There's a lot of marketing propagandas going on so that people can sell specific type of drugs, especially from some pharmaceuticals. So please be very vigilant of where you get your sources of information. And so I'd like to mention just a few sources of information that would be very important for you in case you have any queries that you can always go and check in. First is the Ministry of Health of Kenya. You can check their website. They also have several articles and several pages concerning information for COVID-19 pneumonia. Check also the WHO website. It's very rich with information for COVID-19 and gives you the latest updates in terms of the new research and what is changing in terms of COVID-19 disease management. We also have the CDC, which is the Center for Disease Control. They also have a website which you can check. And for those people who like maybe in-depth or intensive reading, or healthcare practitioners, including nurses, clinical officers, medical officers, you can also check the Infectious Disease Society of America, the IDSA. They also have very good guidelines and very good flowcharts in terms of management of patients who have mild, moderate, severe, and even critical disease. So thank you very much for having me and listening to me today. And I hope that we shall keep ourselves empowered with information so that we are able to really govern the spread and also the terrible effects of this disease. Please follow the ministry guidelines in terms of curfew, uh, social distancing, keeping yourself away from social gatherings, washing your hands, wearing masks, because in the long run, all these are to help us and to help the people and protect the people that we do love. So thank you very much. My name is Dr. Kithinji. Have a good day. Thank you.
So thank you so much for tuning in to this interview. We have had an opportunity to hear from JBA medical experts who have been handling COVID issues. Let us not demonize the issues of medicine, because even in the Bible, Dr. Luke was among the disciples of Jesus. And even us, so many of us, even who are confused about it, also have vaccinations already for fever, yellow fever, and others, polio, and others. We are still taking our children to these places. However, I'm not forcing anybody. This was just for information so that you can make a sober decision. But there is something. I was talking to a bishop the other day. I asked him, you take aspirin. Have you ever known the content of aspirin? All through Panadol. Even the medicines we rush to, even foods in the supermarket, we don't know the chemical composition. So people are bringing hypes against vaccination because of just wanting to be controversial. I was talking to a bishop. I asked him, You have a granddaughter. Were they taken for vaccination? He told me he has 7 jabs, and you are busy here saying that vaccination is demonic. However, we are not pushing anybody. You have heard your the testimonies from the doctors, but there is something that is happening now, which was even happened last week in America. They have just proved that people, 97% of the people dying now are those that have not been vaccinated. That is a record, medical record, and for that reason, that is why you have found people like Biden saying that now the entire America and other countries in Europe, that anybody who is working must be vaccinated or must report every week. So don't endanger yourself and endanger others. This video is not about going against medical science, divine healing. You have already seen the scriptures scrolling down there, over 100 scriptures on divine healing. So we are very balanced. I have also, I believe in divine healing. I've prayed for so many people with incurable diseases who have been healed, and I know God is a healer. But even with that position, God does not allow us to remain ignorant. That is why medicine and other health cares are from God. As a parting shot, I would like also you to reflect. When you say that you don't subscribe to medicine or to medical health, or healthcare, let's say healthcare, medical healthcare, do we say that our wives should not be giving birth in hospitals because we don't even know what the kind of drips they are put during that time? Because I have visited people in the hospitals. My children were given birth in hospitals. When I went to visit my wife, sometimes they even put some drips or some medication, and I never bothered to know what is inside. So all through, we are a product of healthcare from when we were young. So let's make the right judgment. Thank you so much for being with us. Make the right judgment, but our advice, don't allow yourself to die foolishly. You'd rather try what God has given, the wisdom which has kept the nations together, and also noting that very shortly, because of people not able to, because of nations wanting to protect their citizens, that very soon you will not be able to travel to other countries. Already like America, Europe, already they are saying that nobody enters there without a vaccine. So what do we do? Do we stop preaching? Do we stop now going to the nations because we don't want injection? So just make your decision, not forcing you, of course, but I think you have heard from the experts, and I don't need to emphasize more. I just need to pray for those that have been infected by this virus, so that God's grace can be. I'm confident to tell you God healed me from it out of divine health and also health care. Dr. Ian has already told you, I was with them, although I never went into critical condition of health care, of inhalers, but it was my first time to ever be admitted in 29 years in hospital. So I subscribe my health of those 29 years to God. But again, when the COVID came, I needed health care. And we have lost so many ministers. I have lost so many dear pastors. So, servant of God and the church, take courage and let's pray. Father, in Jesus' name, I thank you because of those that have been listening to this interview with experts, medical experts, that Lord, nobody will die or nobody will be destroyed their health because of ignorance and confusion. Lord, you have brought everything to light. Even those who are sick, may you heal them. You healed me, may you heal them. We believe in divine healing. Thank you for all the scriptures that are scrolling in this video. Let them be a portion to everybody's health and their future and their family. Health comes from you, Lord. We engage those divine principles of healing and also the case studies of healing and even the promises of healing. And we thank you because of many people that you have also used me to pray for, to be healed from incurable diseases. May the same healing grace flow through those who are listening to, who have been listening to this video, and let them also be wise in protecting themselves, the others, and their families, and that none will die again from this infection of COVID-19. We honor you, we praise you, because you are our healer. In Jesus' name, amen. The Lord bless you. Amen.